Internal rotation of the arm and shoulder is present in almost every client that we assess and one of the main contributors to shoulder pain and injury. The inability to externally rotate at the shoulder needs to be corrected, and for that we use the side plank progression. For most, we will begin on a wall. And basically what we will be doing is taking our arm into a side range of motion. We will also be using our leverage up against the wall to create our external rotation at the shoulder. Now keep in mind, we will be benefiting our hand spread dexterity and wrist range of motion. But for this exercise and video, we're going to approach this from the shoulders perspective. Begin by facing the wall at a distance to where your knuckles are touching with a straight arm. From there, you will place one hand on the wall at a height to where your whole palm is touching. The more we move down, the more aggressive this angle gets at the wrist, and sometimes the butt end of the palm starts to come up. We want it at a height to where the whole palm is pressed up against the wall. Then spread your fingers as wide as you can, and the anchor point for this exercise is now set. From here, we will begin to open up our foot positioning to increase the range of motion of this stretch. And we do this by taking small incremental steps until we start to feel a stretch run anywhere along the hand, wrist, lower arm, upper arm, shoulder, and chest. Now, as we open up our positioning, it is critical that we maintain two important factors. One, our elbow maintaining a strong extension, and two, that straight elbow externally rotating back behind you. This in turn will create our external rotation at the shoulder joint. In fact, the more that we can maintain the straight elbow and the externally rotated elbow, the deeper we're going to feel this stretch. If you find yourself not able to correct a bent elbow or an internally rotated shoulder, then you need to take your foot positioning and begin to adjust it back in towards the wall until you're able to extend that elbow and externally rotate at the joint. Ideally, we would like all clients to be able to achieve perpendicular or 90 degrees from the wall, or better yet, even further, while maintaining a straight elbow and externally rotated shoulder. Create more ability at the shoulder to externally rotate, and your shoulder pain will find relief quickly.